You're still watching Business Breakfast on iBrandTV. A new National Health Insurance Authority Bill 2021 was signed by President Muhammadu Buhari last week, which is a telecommunication tax in the equivalent of a minimum of 1 kobo per second for GSM calls. According to the bill, it is to finance free healthcare for the vulnerable group. However, Association of Telecommunication Subscribers has kicked against this move. Now let's get talking. Joining us to discuss this is Moses Brima, public health expert. Thank you for joining us.
Thank you very much for having me.
Now, let's begin by clarifying what this bill is and what it's supposed to achieve.
Okay. Currently, we understand that in Nigeria, a lot of our infrastructures and services being provided by government are not doing well as expected. Health, especially, is one key area that we all know is critical for our development. Now, based on advice, the government now decides to set up an health insurance act. This is because health insurance is very critical to the development of healthcare services and delivery for citizens. If you look all over the world, that is the way to go. And the few Nigerians who have been benefiting from what has been going on in the last few years in that sector through the health insurance, we attest to that. Now, there is need for the government to bring everybody on board. So based on that, that was how this National Health Insurance Act was passed. So that is basically what it is.
Well, the vulnerable groups, which the federal government has stated to be including children under the age of 5, pregnant women, aged, etc. This is a large group. How do you think this tax will go round?
Now, it's a very good move to recognize those part of us, because the truth is the society can never be at the same level in terms of economy for everyone. So the government decided to say, okay, this is the way we should go about it. We've identified a certain group of people who we think cannot afford to pay for their services, because healthcare is very expensive. And the best way to do it is to create a special fund for them. And that fund, they now came up with measures how it can be funded. It includes the government itself making some amount of money available. And they also talked about company health levy, tax levy for corporates, certain percentages. And they also talked about telecoms as another means of raising funds. And outside that, even the body has been given the permission to do some kind of strategic investments. And also, they can also receive money from donations, from grants, development partners, voluntary contributions, all sorts of ways to raise the necessary funds. So these are some of the ways that they are expected to raise funds that they will use to support those who have been identified in the act as vulnerable group.
But looking at the system of Nigerians having to pay 1 kobo per second on their phone calls, isn't this like robbing Peter to pay Paul? Because some of these people who belong to these vulnerable groups also make phone calls.
Well, it's a good one, because if majority of Nigerians are made to contribute to it, indirectly or directly, I don't think there's anything wrong with it.
Including vulnerable people who you are trying to help?
Yes. Sometimes this thing you have to make some kind of contributions one way or the other. But the question is that I will be advising on is that the best way to get that funds through the telecoms? Likely no. Why? Because from the reactions and feelers we are getting, the operators are not happy with it. Why? Because they felt that as it is, they will be forced to pass heavily some of this burden on their business. Why? Because they're already facing serious challenges with power to power their stations all over the country. In fact, before this thing was made public, they've already written the federal government through the NCC under their association that they want to increase their tariffs across board by about 40%. So when you add this to it, it means they will somehow they are going to add this to that 40% because it was not part of their initial calculation. So, and from one analysis I saw sometimes yesterday, they said if you now look at it, if this is allowed to fly, it means that the percentage or the percentage tax they will be paying for consumers will move to about 21%. Because once you add this particular 1 kobo for per second billing, you add excise tax, you add VAT, 7.5, everything comes to about 21%. And they said that is quite high. So my honest advice would be that why the idea is not a bad one to find ways to raise this money, the group, telecoms group should have been engaged, and ways and means can be found to get some funds, but probably not in this dimension that they felt is going to impact largely on their operations and their consumers.
Also, when you look at the figure, the number of people that the federal government is trying to reach with this intervention, that's put at 83 million vulnerable Nigerians. But considering the lack of data, the fact that the last time Nigeria conducted population census was in 2006, and we are a bit behind schedule now, how do you think the federal government intends to locate and single out these vulnerable Nigerians? Moses, are you with us? Okay. Okay, we'll try to link back up with Moses. Looks like there's some audio issues there. Okay, thank you for joining us again. Yes.
Yes, you can hear me.
Yes. Did you hear my last question?
Yes, I did.
Okay.
Yes, I did.
Now
listen. Now listen very carefully. You can't wait till you have a successful census before you start some of these programs. We already have some data, though they are scattered, but through the NIM, NIMS's efforts in trying to bring in Nigerians, we have some figures. We have some figures we can begin to work with. And
how credible are those figures?
When you say you are certain, well, they will continue to clean them up. Technology is a very interesting thing. If you know how to use it, there are measures, and before you are qualified for this, you don't just come and say you are an indigent person. Some things that they will require from you, and that will help them to even improve on the existing.
Okay. Well, talking about how the federal government intends to locate these vulnerable Nigerians, which they have put at 83 million people, talking about pregnant women, people under the age of 5 years, the aged, and so on and so forth. How does the federal government intend to locate these people, considering the fact that data is scattered or not something that is easy to come by in a country like Nigeria? Well, he is saying that with the NIMSI, the NIN, and all of the registrations that Nigerians have done, that the federal government would leverage on those data on those different platforms to achieve this. Well, we'll see how that goes, especially when you consider the fact that there are a lot of issues when it comes to collating data in Nigeria. Well, this is also another issue that the federal government is hoped to be able to overcome when it comes to providing this health insurance policy. Thank you for joining us again.
Thank you for having me.
Yeah, so I'll just let you land on that thought before we go on.
Okay. And I believe very strongly that the time has come for this to happen. If you know what is going on around the country, especially in the sector, we just have to find a way to start. Even if you have the full data, even if you have a data that you think is even credible, you can't reach everybody at the same time. It will take some period, it takes some years. So we cannot say we are waiting for anything to be perfect before we start. So that's the more reason why we have to find a way. We have to start as much as we can. Those we can verify, we start with them. Those who cannot be verified, we tell them things that they will do to get verified. so that we can capture their data properly. And they will be recorded. As long as we have the right technology platform to implement this, I think we are, I would advise that we go ahead. However, I would advise that the government have a roundtable with the telecoms operators and try to see how they can meet them somewhere. And then, because from what we've heard, the estimated amount that the government is targeting from this exercise, from the telecoms, say about 90 billion annually. That's a lot of money. I don't think the federal budget in Nigeria, I don't think so. I can't do it. I may be wrong. That is up to about that amount allocated to the Federal Ministry of Health. They may have different projects that would allocate funds to, but in terms of the Federal Ministry of Health and the various tertiary health institutions we have in this country, I doubt if that kind of amount of money is available. So, this will come, but if it's coming for just one.
Okay, talking about what the expectations are from the telcos, the federal government, according to Moses, is expecting to generate 90 billion naira annually from the telcos to finance this particular scheme, talking about the National Health Insurance Authority Bill 2021. Thank you for joining us again.
Thank you for having me.
Okay, let's talk about the fact that this particular funding, or rather the federal government has mandated states to have national health insurance scheme. How do you see this going? Do you see states responding, or do you see this as the way to go?
Some states are already having that now. In Lagos, for example, you have the Ilera Eko and all that stuff. I know Delta State are doing, so many other states, they've come up with.
Yes, but we're talking about states that do not have an existing one.
They will have to have it. It's not rocket science. That's what I'm trying to say, that some are already doing it. Those who have not started, they have places to learn from. So they can actually take off within a very short time. All they need to do is to look at the templates of other states and then try to develop something, and so that they too can begin to benefit the citizens in their states will begin to benefit from it.
What are your final thoughts on this new scheme, or rather on this new development by the federal government?
I'm in support of it, 150%. Anything health insurance, I'm a strong advocate of it because I've been a very strong beneficiary of the health insurance, especially those from the private sector, part of it, from the HMOs and stuff like that. So I understand and I know what it is to myself and my family. And I think other Nigerians should also enjoy it. But at the same time, in trying to fund it, the government should also look at the economy strategically, and any group you are trying to put in such activity like the telecoms operator, I still believe they should sit with them and also sit with other interest groups to look at it dispassionately so that everybody is happy with what is going on, and also put in measures in place to ensure that there is no abuse of these funds. You know, Nigeria.
Mismanagement.
So this extreme mismanagement. So all these things need to be looked at.
Do you think that can be totally curbed?
Not necessarily. It can, but it can be reduced to a level where the benefits go round very well.
All right, that's a fine place to leave it. Thank you so much, Moses Brima, public health expert, for your thoughts on the show this morning.
Thank you for having me.
And have a bright day.
Yeah, bye.
All right, still to come on the show this morning, gold price kept its bullish undertone intact, starting out a fresh week, reaching fresh 9-day highs at $1,885 before reversing sharply to finish modestly higher at $1,854. More details after this break. Please stay with us.